Hospital Association is opposed. The AARP, the largest senior group in America, is opposed because they know the horrendous impact this will have in raising premiums for older workers. American Cancer Society opposed. The American Heart Association. I'm thinking they are saying, look, the Affordable Care Act has done some good things. Before the Affordable Care Act, Mr. President, we had some 50 million people without any health insurance. Affordable Care Act provided insurance for about 20 million people. That is no small thing. In the majority leader's own state of Kentucky, the rate of uninsured went from 20% down to 7%. That's pretty good. Not great, but it's pretty good. West Virginia, rate of uninsured went way down. So we have seen 20 million people gain insurance. We have dealt with the Affordable Care Act under a total obscenity, and that is if somebody had a serious illness, breast cancer, diabetes, they could not get insurance at an affordable cost because of a pre-existing condition. How insane is that? The American people said that is nonsense. What's the function of insurance if not to cover us when we need it the most for those illnesses that we have had? And we ended that absurdity. That was a good thing. Affordable Care Act has done other very important things. Have you heard, Mr. President, one member of this body say that the Affordable Care Act is perfect? Have you heard one person here say that the Affordable Care Act does not need to be improved? Of course it does. Right now, throughout this country, in my state of Vermont, all over this country, deductibles are too high. I've talked to people at $5,000, $10,000 deductibles. They can't go to the doctor when they should. We've got to lower deductibles. Co-payments are too high. Premiums are too high. And I'll tell you something else, Mr. President. Donald Trump ran for president. He campaigned, and he said, I'm going to stand with the working people of this country. Prescription drug costs are too high. I'm going to take on the pharmaceutical industry. We're going to lower prescription drug costs in America. Mr. President, today, if you can believe it, 1 out of 5 Americans under 65 cannot afford to fill the prescription their doctors write. Mr. President, today somebody walked into a pharmacy and found that the cost of the medicine they've been using for 10 years has doubled, maybe tripled, because we have no legislation that stops the drug companies from charging us anything they want, and they will charge us anything they want. And the result is we have the highest prices in the world for prescription drugs. Those are the problems that the American people want answers to. Deductibles too high, premiums too high, co-payments too high, prescription drug costs too high. We're not doing enough good work in primary health care. Too many people, even with insurance, cannot find the doctors that they need. And many other problems. Those are what the American people want us to solve. This legislation only makes a very bad situation worse. How do you improve health care in America when you throw 16 million people off of the health insurance they currently have? How do you improve health care in America when, according to the CBO, premiums are going to go up 20% every year? Let's get that clear. 20% on January 1st, another 20% the following year. That's 40%, another 20% the year after. Do you think, Mr. President, that this is really improving health care? This is bringing freedom to the American people? I think not. So what is the solution? The solution is, I know this is a radical idea, that maybe we should do what the American people want us to do, and not what special, powerful interests want, not what billionaire campaign contributors want, whose right-wing ideology wants to end government services for working families all across this country. So I would hope, Mr. President, that we have the common sense and the decency to sit down, throw the problems on the table, and then resolve them. And I think we can do that. And that is why we have to end this absurd process. We have to go back to regular order, which simply means go back to the committee. I'm a member of the Health, Education, Labor, Pension Committee. Let's have that discussion. Let's hear different ideas. Let's solve problems. Let us not make a bad situation worse, and let us not make the American people even feel more contemptuous of this institution than they currently do. Thank you, Mr. President. I yield the floor.
Mr. President.
Senator from Illinois.
Mr. President, I want to thank my colleague from Vermont. Mr. President, in my hand is one of the closely kept secrets in Washington, D.C. These 8 pages have been so carefully guarded that for 3 days we have been on the floor of the United States Senate waiting for this moment. Within the last hour, the Republicans finally released their plan to change health care for every American. We've been waiting a long time. They've been meeting behind closed doors, secret sessions, writing what I have in my hand here. And you have to think to yourself, why would they do it in secret? If this is something that will affect every American, family, business, and individual, and if they're proud of what they've done, why did they wait so long? Well, when you read it, you can understand it. Because this measure proposed by the Republican leadership makes things worse for American families when it comes to health insurance. It's got a great name. I'm sure somebody invested some time in thinking about this one. The Health Care Freedom Act. Freedom. Well, it appears that for 16 million Americans, they will be free of health insurance protection. 16 million Americans will lose their health insurance protection because of this Republican plan. And every other American buying health insurance will be free to pay 20% more each year for the premiums on their health insurance. You don't have to be a math major to figure out compound interest at 20% a year. By the 4th year, you're knocking on a 100% increase in your premiums. So your health insurance premiums will double in about 4 years under the Republican plan. Is that why they started this debate? So they could take health insurance away from millions of Americans and raise the cost of health insurance for others? 4 senators had a press conference this evening at 5 o'clock. I watched it carefully, and I listened as my colleagues came to the floor, and those 4 senators described this plan. They'd seen it, the so-called skinny repeal plan. One of the senators said about this plan, it was a fraud, it was a disaster, it would have a disastrous impact on the premiums charged people he represented in his state, and that it didn't achieve the goal of reforming and repairing the Affordable Care Act. Now, I quickly add, because you'll think, well, we expect the Democrats to say that. This was a press conference of 4 Republican senators about 6 hours ago. They had read the Republican plan and called it a fraud, a disaster, raising premiums, and not really bringing reform to health care in America. It only takes one of those 4 senators to stand up and speak up and vote no for the right thing to happen, for this proposal to go to committee where it should have started and to be considered by the experts first so we know its real impact, then to have an amendment process where better ideas might be offered and debated and added to this proposal. Then if it's voted out of committee, bring it to the floor of the United States Senate for the same thing to happen. Do you know who came up with that radical idea? That we go through the committee process and both parties participate in writing this reform? None other than Senator John McCain. He came to this floor a couple days ago, and it was an historic moment. Everybody, both political parties on their feet, cheering this man whom we've served with and love and respect. And he warned us. He warned us that if we didn't do this together, Democrats and Republicans, the results would be terrible. Can we afford terrible results when it comes to health care for your family, for you, for your baby? Of course we can't. We've got to do our level best, not to win the political debate, but to win the confidence of the American people that we understand how to make health care better and more responsive in America. I've been through a lot of measures and I've voted on a lot of things over the years. My proudest vote was for the Affordable Care Act because I knew that we would extend the reach and protection and peace of mind of health insurance to millions of Americans. I had an experience early in my life, newly married, brand new baby girl, serious health issue, and I had no health insurance, none. And I went to the hospital, local hospital here, waiting in the charity ward in the hopes that the doctor who walked through that door would be the one who would save my baby's life. And I thought to myself, I'll never let that happen again. I'll have health insurance no matter what it takes the rest of my life. I know the feeling, and some others do too. I don't want American families and individuals to go through this. I want them to have the peace of mind and protection of good health insurance. That's why this Republican proposal taking health insurance away from 16 million Americans is such a travesty. That's why the notion of raising health insurance costs beyond the reach of working families is so wrong and so disgraceful. And that's why, with the help of one more Republican senator, we can send this measure back to a committee where it can be seriously considered, worked on, improved, and passed so that we can say to the American people, we did our job as senators. We did what John McCain challenged us to do, to come together on a bipartisan basis and to make this a better bill. I'm glad my colleagues are here this evening. I'm glad to see my friend from the state of Wyoming who's here. We've worked on many issues together. We disagree on this one. But I hope that he will realize, and others will too, this secret that they've kept from the American people is just plain wrong. It's a secret that now it's been outed, has to be put to rest. Let's do this the right way. Let's do it for the well-being and health of American families across this nation. Mr. President, I yield the floor.
The senator from New Jersey.
Mr. President, I stand today sort of feeling like a great New Jerseyan named Yogi Berra, who says, has a saying that this is deja vu all over again. And the reason why it feels like deja vu all over again to me is because I've been watching this process move along. And when the House first tried to push through a health care bill, and I'm so proud that the American public, Republican and Democrats, outraged stopped that version 1 in the House, but then version 2, they rushed through without a CBO score, they got it done. And we heard Republicans in the House literally saying on the record that I so hope that they'll fix this in the Senate, that maybe something will happen in the Senate, that this will get fixed. Well, now I have deja vu all over again. It's because we see a whole bunch of folks, and now we've heard Republican senators say this on the record, that, gosh, we know what we're doing is flawed. We know what we're doing is wrong. We know the process has been outrageous, but our hope is if we can get it into a conference committee, then they'll fix it in the conference committee. Well, I'm proud to be a United States senator, but dear God, this is not what this body is about. To push their responsibilities off, to derelict their duties, and to not make legislation happen here that puts people first. We all know this process is broken. We all know what we're doing here is not just imperfect. Many of us see this, like the CBO, as a serious threat to millions of Americans. We're about to do something that is unconscionable to me to be in the United States Senate, where I have seen this place work. I have seen regular order. I have seen hearings. I've seen witnesses brought in. I've seen people work hard on crafting actual legislation. And so now this is just going to be shoved over with the hope in this body that even though the House didn't do their job, that the President of the United States even criticized what the House did, called it mean, it gets kicked over to the Senate, and the Senate is refusing to do their job. They're just passing the buck to something called a conference committee where they're going to hope again. And so I stand here and I just have to confess, this has been a 2 days for me where I haven't just been frustrated and angry like so many Americans. I've actually been struggling with being a little sick. I started feeling it about 2 days ago. By yesterday, my throat was so sore. I went to bed, had the horrible night, got up, could barely even swallow. I had the worry in my head that maybe I had strep throat. But guess what? Unlike the thousands of New Jerseyans who've reached out to me, the worry about an illness for me, maybe that I have strep throat, I went to a doctor today. I had myself tested for strep. You see, we in this body, we enjoy health coverage that right now millions of Americans are worried about losing, and many other ones worry, as we said tonight, about co-pays and prescription drug costs. And I wonder where the justice is in that. What are the American values that hold us all together? I know we pledge allegiance to that flag, we put our hands on our hearts, and we swear this oath to liberty and justice for all. Where is the justice in this country where some people who are favored and privileged enough and wealthy enough to afford good health coverage can have it, but for other folks, a night with a bad sore throat or worse, with a disability or disease, where's their justice in the wealthiest country on the planet Earth that we can't even in this body come together and do what the president said in his campaign that he would do? Everyone be covered, get a health care that I think the quote was terrific. Well, it brings me back to what our values are as a country, and I wonder, we who believe in life and liberty and the pursuit of happiness, how can you have life when we see millions of people about to be thrown off their health coverage? We in this nation, we hold these values so dear. We believe that all are created equal, and in my belief should have equal rights and equal opportunities to the basics that are necessary to succeed and to compete, and that's health insurance. I wonder how we've gotten to a point as a body on an issue like this that's not just 1/6 of our economy, not just will affect millions and millions of lives, but really goes to the core of who we are as a country. There's a great man, Patrick Henry, who said, "Give me liberty or give me death." Those words have been coming back to me a lot in these last months of this debate and this discussion. Give me liberty or give me death. Well, what is the quality of the liberty in this country where there are people that are shackled with preventable disease and conditions that could be treated because they don't have access to health care? What is the quality of liberty in this country where people are chained to poverty, have to sell their cars, have to sell their homes, go into bankruptcy because they can't afford their health care coverage? Give me liberty or give me death. What is the quality of the liberty when people are imprisoned by fear and worry and stress because they have a sick child? They have a parent that is elderly and needs care. These are the values of this country, and I don't understand how we could be at this moment right now where the ideas that I've heard on both sides of the aisle to make health care better, to improve upon the Affordable Care Act, to extend health coverage to even more people, to make this nation live up to its most powerful and profound values that made us a light unto nations, how we could have gotten to this point now after gaining ground, after having more people experience the freedom and the liberty that comes from not having to worry about your health coverage, from having access to quality health care. How can we have moved forward and now be about, in a matter of hours, to push this nation back? I don't understand how we can be here where no one can justify the process, no one can justify this body having gone through such a contorted process that bends our traditions, that breaks our our values, I do not understand how we could have gotten here. And who will be hurt? Who will be hurt? I've read lots of studies recently about how when health insurance rates go down, mortality rates go up. When health insurance rates go down, mortality rates go up. And it makes me wonder about the duty that we each have to each other as Americans. As a man of faith, it makes me wonder about all of us who profess our faith, how we could be allowing a process to go forward where the most vulnerable amongst us will face fear and deprivation, will see things that will cost life and have them surrender liberty. We are better than this. This nation is greater than this. This moment is cast a shame and a shadow over the soul and the heart of America. And I will fight, even in these last hours with every breath that I have, like the patriots before us, not to allow this to happen to my fellow American. This is unjust, this is wrong, and we can and must in these hours do better. Let's send this bill into committees. Let's do this process as this institution was designed to have it done. Let's open the doors of the Capitol and invite America to come. The American Medical Association, the Cancer Association, hospital associations. Let's invite the AARP. Let's have America come down here. Let's join together like our forefathers and foremothers have done to expand liberty, to expand opportunity, to extend hope. We can do that. All of us collectively have that power, and it's what the people want right now. This is not what the people want. What we're about to vote on has only seen the light of day for a matter of minutes now. A matter of minutes. This nation was founded with a proclamation that we, the people, this idea that all of us together can do better, that when we join together, when we stand together, when we fight together, and when we work together, we can create a transcendent reality. That's the story of America, and this is not. This is the betrayal of our values. This is the betrayal of our history. This is a betrayal of the great body in which we all are members of. Thank you, Mr. President.
Mr. President.
Senator from Hawaii.
Mr. President, so many of us have spoken so many times now against the repeal of the Affordable Care Act, which would hurt millions and millions of people in our country, and especially the sickest, poorest, and oldest among us. I would say that I am probably the only senator here who was not born in a hospital. I was born at home in rural Japan. I lost a sister to pneumonia when she was only 2 years old in Japan. She died at home. Not in a hospital where maybe her life could have been saved. It's hard for me to talk about this. I think you can tell. Give me a moment. When I came to this country as an immigrant, my mother brought me and my brothers to this country so we could have a chance at a better life. And we came here with nothing. She had low-paying jobs. There was no health coverage. Growing up as a young girl in Hawaii, my greatest fear was that my mother would get sick. And if she got sick, how were we going to pay for her care? How would she go to work? And if she didn't go to work, there would be no pay, there would be no money. I know what it's like to run out of money at the end of the month. That was my life as an immigrant here. And now, here I am, a United States Senator. I am fighting kidney cancer, and I'm just so grateful that I had health insurance so that I could concentrate on the care that I needed rather than how the heck I was going to afford the care that was going to probably save my life. And guess what? When I was diagnosed with kidney cancer and facing my first surgery, I heard from so many of my colleagues, including so many of my colleagues on the other side of the aisle, who wrote me wonderful notes sharing with me their own experience with major illness in their families or with their loved ones. You showed me your care. You showed me your compassion. Where is that tonight? So I can't believe that a single senator in this body has not faced an illness or whose family member or loved one has not faced illness where they were so grateful that they had health care. I cannot believe that there is a single senator who has not experienced that in their family or their lives. So I know how important health care is. What I don't get is why every single senator does not know that. Why are we here tonight voting on a bill that has not had a single hearing? Why are we here tonight voting on a bill that would eliminate health care coverage that could save lives for 16 million people? Why are we here voting on a bill that will probably mean that people like me, millions in this country, who are now in the ranks of those with pre-existing conditions, will not get the health care we need? Why are we here tonight? Where is your compassion? Where's the care that you showed me when I was diagnosed with my illness? I find it hard to believe that we can sit here and vote on a bill that is going to hurt millions and millions of people in our country. We are better than that. I listened to John McConnell calling on us to have hearings, to do the right thing. And I'm just saddened that he was not able to move us in that direction. I would call on him tonight to vote his conscience, to vote with us, who say we are going to stand for the millions of people in our country who will be hurt by what we're contemplating tonight. Mr. President, I will yield the floor by asking my friends to show the compassion to everybody in this country that you showed me. We all should be voting to send this bill to committee so we can debate it. I yield the floor.
Okay. Thank you. Mr. President.
Senator from Virginia.
Mr. President, I also rise with my colleagues, tremendously moved by the powerful words of my friend from Hawaii. Why can't you show the compassion to others that you showed to me, is her question, and that is a haunting, haunting question, and I hope people will hear not just with their ears, but with their heart. I also rise to support the motion to do what we should have done in January, to commit this important topic to the committee that has jurisdiction over it. A few years ago, there was a popular thing to do, and it was to wear a button or a bracelet with the letters WWJD. That button and bracelet stood for What Would Jesus Do? I was on the floor the other night, and I don't think that's a very hard question, because in Matthew 25, he basically tells us, I was sick and you cared for me. In different translations, I was sick and you looked after me. I was sick and you visited me. I was sick and you took care of me. I think the answer to WWJD is pretty straightforward tonight, but I'm actually going to talk about a different J, John McCain. John McCain, based on the tremendously moving presentation that he made here on the floor the other day, one that led us to a standing ovation because he talked about how this body should improve. He said that things weren't working here as they should for the American public. He said we needed to fix the Senate and be an example for the public. We needed to restore confidence, and the way to do that would be to return to operate as the Senate should operate with putting bills in committees and having hearings and listening to the public and maybe most importantly listening to each other. That is the process that John McCain's committee just used, the Armed Services Committee, to get a unanimous defense authorizing bill out to the floor, which I hope we'll take up in the next few days. And so I just want to spend a few minutes talking about if that's what we should do, if those words led us to leap to our feet in a standing ovation, why are we here 2 days later preparing to break every suggestion and recommendation that he made to us? When should we start the process of listening to each other and listening to the American public? Should we start on an inconsequential issue that doesn't matter? I think now is the time to start. I think we all know it's the time to start. If we didn't believe in our heart that now was the time to start fixing this place, we wouldn't have leapt to our feet and given Senator McCain a standing ovation. This is the time, and this is the issue, to start fixing this place and doing what we do with the spirit that is worthy of the American people who send us here. Why is now the right time? First, because this issue is so important to people. You heard moving words from our friend from Hawaii and our friend from New Jersey, and we have all spent months going town to town in our states and having people come plead with us for solutions. I shared stories about being in the medical clinic in Appalachia a week ago tomorrow and seeing the tremendous need in this richest and most compassionate nation on earth. There is nothing about a person's life that is more important than their health. There is no expenditure that a human being ever makes that is as important as an expenditure they make about their health. This is the right issue to start fixing this place because it's important to people. It's important to the economy. This is the largest sector of the American economy. We are proposing to reorient 1/6 of the American economy on a snap vote in the middle of the night without having a single hearing or listening to a single expert. It's an important issue because we definitely need to hear from the public. You know, committee hearings sound kind of wonky. We haven't had a committee hearing. What does that mean? What it means is we haven't had a witness table where a patient or a doctor or the American Cancer Society or others could stand up and share their points of view. We need to listen, and if we don't listen, we won't get this right.
The senator's time has expired.
With 2 minutes, I would like to close, Mr. President.
Is there objection? Without objection.
The time is right because the consequences are so severe. 16 million people lose insurance, 20% premiums compounding over the years, insurance markets skyrocketing and unstable, and Planned Parenthood defunded, the health care provider of choice for 3 million women. But, Mr. President, the final reason we should do this the right way, not the wrong way, is what was said by Senator Graham just a few hours ago. He described the bill that is now on the floor, the skinny repeal, the skinny bill as a policy is disaster. As a replacement for Obamacare, it is a fraud. Is fraudulent disaster the best that the United States Senate can do now? Is that now the bar we have to get over? If we can say something is a fraudulent disaster, it's suddenly good enough to vote for? That is salt in the wound of a family that is worried about their sick child. That is salt in the wound of anybody who's worried about what will happen to their family tomorrow. Will they lose insurance? Will they pay more? Will they be blocked from going to Planned Parenthood? If this body passes a bill that even members who vote for it claim is a fraudulent disaster, how do you think the American public will view this body? How will they view the degree of care and concern that we exhibit towards them? This is not the best that the Senate can do. We can do much better than this. We must do much better than this. And I ask my colleagues to send this to committee where we can listen to one another and get this right. Thank you, Mr. Chair. I yield the floor.
Mr. President.
The senator from Wyoming.
For 2.5 days, I've been listening to the same rhetoric. Talk about deja vu. For 2.5 days, I've been listening to this. I've been giving extra time to the other side to speak. I've been hoping that out of that, I would get one constructive suggestion for what could be done with health care. It's all been criticism. It's been criticism against all. Even tonight, after the bill was read here on the floor, I heard that we were changing Social Security. We are not changing Social Security. We can't change Social Security under the budget. I heard that we were changing Medicare. We're not changing Medicare. I'm not going to allow other time for that side. I'm going to suggest that that side of the aisle go and read the bill. I think it would be a worthwhile exercise. There isn't even Medicaid in there. You've threatened about what was going to be done with Medicaid. You talked about what was going to be done with Medicaid, but it's not based on fact. So take a look at the bill. Another way that this is deja vu is I remember being here on a Christmas Eve when technical corrections were expected from the other side, but you went ahead and passed this bill. And we have mentioned things that needed to be changed in the meantime. And we've told, no, that doesn't have to be done. It just needs more time. Well, we've had more time, and there does need to be corrections. You keep talking about how the Republicans have ruined the insurance market. No, last October, the high rates came out for states across this country that pointed out that health care was going down the tubes. So something needed to be done. Something needed to be done. But without getting constructive suggestions from the other side, just criticism, saying Obamacare is perfect until this debate started. And then I started hearing, it's not perfect. It's not perfect. Well, where are the suggestions for making it as near perfect as possible? We've put up all
Mr. President?
I'm not asking that as a rhetorical question. I mean, I'm not asking for you to think about it for a little while, come up with some construction.
Mr. President, I'm
The
just
senator
wondering,
from Wyoming has the floor.
would he yield to a question?
No, I will not yield for a question. When I feel like there's something constructive that's going to be done around here, I remember that one of the senators on the other side of the aisle said, if you just take Medicaid out, I'll be for it. Well, Medicaid's not in this version. So that ought to be some kind of a commitment on it. I keep referring to this book, which goes back to a lot of the history that we've experienced around here. Here's what's happened. And all of this is footnoted. I was really impressed with the footnotes. I didn't check out all the footnotes, but I did look to see if they were footnoted. Under the bill that we're trying to make some changes in, there have been costs from new taxes. There are 21 taxes that have been included in Obamacare, but the most enormous one is the increased taxes on healthcare companies that are then passed along to the public as higher costs for insurance and pharmaceuticals. I have heard that word pharmaceuticals thrown out a lot, and I agree there are some things that need to be changed there. I do remember the pharmaceuticals joining in on the process of getting Obamacare passed because they did this little thing with the pharmaceutical Part D where there was this donut hole, and through the donut hole, we were hoping that people would switch to generic. But the pharmaceutical company said, no. If you will stick with the brand name, we will cover you through the donut hole. You know why? Because people, as they go through the donut hole, go beyond the donut hole, and beyond the donut hole, the federal government picks up the costs of the name brand pharmaceutical. And my insurance commissioner was by to visit with me, and he mentioned that I've got a couple of, that I've got twins in Wyoming, and they have a rare disease, and there is a prescription for it, and the prescription is costing $30,000 a year each. Well, that's quite a bit of money, and the insurance company is picking that up. And then the name brand pharmaceutical company bought out the generic one. This was generics that they were getting. So now they have to have name brand because the generic isn't on the market now. The cost? $1.6 million each kid each year. That's why the insurance companies are dropping out of the market. I mean, Wyoming is the least populated state in the nation. And an insurance company that's limited to Wyoming is going to have to bear that $3.2 million worth of cost. And so they're going to be saying, we're the only ones covering Wyoming. Maybe we shouldn't provide insurance in Wyoming either. We lost the other two companies already, and we're down to just one, but we have one, and they cover all of the counties. Unlike, it's kind of surprised me that the rules allow companies to just do some counties in some states. Also, under Obamacare, the insurance plans have to cover more. This includes plans for the patient who may not want a particular coverage but has to have this. It comes under the essential health benefits, which are required through HHS, and this has led to 5 million Americans losing their insurance in the individual market. Reduction of lower cost plans. The high deductible health savings accounts were very important in reducing costs for individuals and families and businesses. A RAND study in 2011 found that an HSA, a highly deductible plan, with a deductible of at least $1,000 would reduce health care spending an average of 14%. That savings incurred not only for patients, but also for employers and for total health care expenditures. These more effective plans have been reduced under Obamacare. Most of the young people on my staff were getting HSAs, and the reason they got HSAs was because they did a little bit of a calculation. They did a little bit of financial literacy. They looked to see what the plan was for the full coverage, and then they looked to see what an HSA would cost. And they said, well, gee, if I take the difference in the cost between the regular insurance and the HSAs, and I put that in one of these savings accounts that can grow tax-free, in a maximum of 3 years, I will cover any deductible that I might have. So they considered that to be good insurance, and they got to make a lot of their decisions. But I don't think we want individuals making their decisions. That appears to be how Obamacare is constructed. And then there's an increase in mandates. That's item number 4. The mandates existed before Obamacare, but dramatically increased with Obamacare. It added mandates of guaranteed issue and community ratings. Both have been previously tried in the state. Such mandates distort the marketplace and drive up the cost of care. Policies within states that had more mandates could actually have doubled the cost of their premiums. Number 5 is increased costs by constricting hospital and physician systems. There's been consolidation with increased hospital mergers by 50% compared to 2009. There has also been movement of doctors' practices to connect with hospital systems, and both the contractures within the hospital system and then physician systems increased cost to patients. For example, group practice charges increased 18% to 20%, and specialty care charges increased even more, 34%, after connecting the care with hospital systems. These changes in care, changing from private practice systems into hospital-based systems, have significantly driven up the cost of care for patients. Number 6, medical legal liability reform has not been a part of Obamacare, but is a significant driver of health care costs. That's not considered in it, and is considered to be about a 10 to 25% increase in total costs.
Mr. President,
and then,
could I respectfully ask the chairman a question?
Does the senator yield for a question?
Just regarding,
I think this is under my time.
It is, and I would just respectfully
Does the senator yield for a question?
Regarding time, I just have a question so that members can know how to manage their time between now and the 45 minutes that we have for a vote.
The bill manager has 46 minutes remaining on his time. The Democrats have 0.
If I could just respectfully ask the chairman, since we've only had this bill for an hour, we have, as you can see, a number of senators who want to speak, and I just would respectfully ask if there's any time that we will have between now and the vote to make any comments, since we just have had the bill for a very short amount of time that we'll be voting on that will obviously impact millions of Americans.
Well, I think the answer that I gave was perhaps your time might be better spent taking a look at the bill, because the conversations that I've heard here didn't necessarily speak to the bill.
Mr. Chairman,
they speak to the process, and I think we've already covered that in 3 days.
Mr. President, would
The senator from Wyoming has the floor.
he yield for a question about the bill? Since he wants us to know more about the bill, he clearly knows more than we do because he's seen it for much longer than we have.
The senator from Wyoming has the floor.
He won't yield for a question?
I want to continue on with why we're trying to change this. And the Galen Institute, Grace Marie Turner, wrote about 70 changes to Obamacare that occurred after it went into effect. And those changes include employer mandate delay, individual mandate delays, preserved benefits to military and the VA, and reduction of funding to agencies used for implementation of Obamacare, including IPAB, co-ops, and the IRS. Co-ops are an interesting thing. I was suggesting during the time that Obamacare was being considered that small business health plans might make a real difference in costs for small businesses. Now, the only thing I can see on small businesses in here is that if you're a small business and you're over 50 employees, you got a problem. I have people in Wyoming that come to me and say, I've got this business, it's working really well, and in the next town over, and most of the towns aren't big enough to hold two of the same kind of store, so in the next town over, I'd like to put in the same kind of shop. And my question is, how many employees do you have? And most of them have said, well, I have about 48 employees. I said, how many will you need in the other store? They said, well, I hope to need the same amount of people. I said, well, the way that this works, you're going to come under much increased health care costs. And you better take a look at that before you make your expansion. And so it has cost jobs that way. Now, with small business insurance,
Mr. Chairman,
with the small business health plans.
The Senate will be in order. The senator from Wyoming has the floor.
will the senator from Wyoming yield for a question about the new study on the impact of Obamacare on jobs? Since he is speaking on this
The senator from Wyoming has the floor.
Will he yield?
I will not yield. I would appreciate the same courtesy from that side that I gave to you when you were doing your expositions about the health care, which included the things that I've mentioned that aren't even in the bill. So our side has some time. I intend to use some of that time. As I've been through this process for a long time now. I've been on the Health, Education, Labor, and Pensions Committee for the whole time that I've been here. That's 20 years. Of course, it wasn't Health, Education, Labor, and Pensions when I first got here, but we thought that that was a clever acronym. We're from the federal government, and we're here to help you. And there are a lot of people back home that don't think we really help out much. But at any rate, the small business health plans, after 3 of us that were in the gang of 6 got thrown off of under the train or under the bus or whatever it was, small business health plans were changed to co-ops. And they were given a significant amount of money to work with. And they haven't fared very well. So, trying to find my co-ops here. Again, this isn't stuff that I wrote. This is stuff somebody else wrote. Somebody else wrote and footnoted and sent to all of us. And again, the name of the book is Demystifying Obamacare, How to Achieve Health Care Reform. And He gives some good suggestions. He does point out that Obamacare is not a system of health care, nor is it health care reform. It's a system of health care control. People are told what they're going to do. Obamacare was supposed to significantly reduce health care costs, but instead it's dramatically increased costs for even those who are not directly within the Obamacare program. Obamacare was supposed to increase access to care, but instead it actually reduced access, the availability to care. Obamacare reduces the effectiveness of the safety net program, which is so very important to economically poor Americans. Under the bill, an amendment that I'd like to see was one that would have covered the people that make under $11,000, $11,800, who can't get insurance. They don't get subsidies. They're just left out in the cold. It's one of the corrections that should have been made, wasn't made. So Obamacare does reduce the effectiveness of the safety net program, which is important to economically poor Americans. There are a lot of people out there in the states, several thousand in my state, that can't get insurance under that. The quality of health care in America was derided when Obamacare was passed, but Obamacare instead reduces the quality of U.S. health care by reducing innovation. And it removes a person's ability to make his own decisions about his health care and that of his family, and it does so by removing the freedom to make those decisions by putting so many qualifications on it. Again, I repeat that we haven't done anything to take people off of their policy if they're under their parents' policy if they're under the age of 26. We haven't done anything to deny patients that have pre-existing conditions. I've heard that for 3 days. And we haven't eliminated the lifetime caps on insurance. I've heard that for weeks. So there are things that need to be done. They could be done. We've tried to do it in this bill, again, without constructive suggestions from the other side, any recognition that there was any problem that ought to be solved. We've gone ahead. It's not my choice for the mechanism that would be used. It's the mechanism that was chosen by leadership, and it falls. One of the things that makes this difficult is it's a budget reconciliation. So there are things that have to be written in a budget form in order to comply. And that limits some of the things that I would have liked to have done that I think would have made quite a difference, and I think it would have been some things that the other side might have joined on and been excited about too. But again, we're limited by the mechanism that we have here.
Mr. Chairman,
no indication that
Mr. Chairman, you yield. Mr. Chairman, you yield for a question about
I've heard
a proposed solution.
The Senate will be in order. The senator from Wyoming has
question.
the floor.
I've heard so many times
about the bill.
The other side
the Senate will be in order.
Cooperative, but I have yet to see the cooperation. And I'm not going to take questions. I'm going to. I really would appreciate it if you just take some time to look at the bill.
Mr. Chairman, we got the bill an hour. We got the bill an hour.
The Senate will be in order.
Maybe this time would be better used if you allowed us to ask you some questions about the bill.
The Senate will be in order. The senator from Wyoming has the floor.
Yes, and I have an hour whether I use it or not. Like I say, for the past few days, I have been yielding time to the other side. I haven't gotten much satisfaction out of that, and I've listened to the last hour, and I didn't get any satisfaction out of that either. I did sit through all of it. I did listen to it. Again, it's complaints about the process, but not constructive suggestions on what could be done. Areas of taxes and mandates and regulations and lack of competition in the marketplace and increasing costs. When I travel across Wyoming, I have people that come up to me and they say, my insurance premium is bigger than my house payment, and it's growing. And they said, and if something happens to us, my deductible is bigger than my year's premium. That shouldn't happen in America, but that's where we are. And those aren't isolated cases. Those are a lot of cases. And that's the situation we find ourselves in. We're not trying to hurt anybody. We're trying to fix some of these things. And like I say, for 8 years, every time there's been a waiver, that's part of that the thing that I mentioned about the 70 changes to Obamacare so far. A lot of those were in the way of waivers. And every time there was a waiver, I said, why are we waiving this? Why don't we just fix it? And I was told it's not broke. It just needs more time. Well, it has had more time. And last year, this is before the election, so you can't blame us. We had no idea who was going to be the president. We had no idea who was going to be the majority. Last October, people started pulling out of insurance markets and rates increased dramatically. You can't put that blame on us.
Mr. President,
Now,
parliamentary inquiry.
Does the senator yield for parliamentary inquiry?
No.
The senator from Wyoming has the floor.
Mr. President, I just wanted to ask how much time was left on a bill we haven't had a chance to look much at in the last hour that we're going to vote on.
I think that
the senator from Wyoming has 34 minutes remaining, and the senator has the floor.
And I think what we have is a motion to commit and the right for the other side to do other amendments. I would hope that some of them would be constructive, but I'm not expecting that. Like I say, I've been listening for 3 days and actually listening a lot longer before that time. I could talk about some of the things that we can learn from Obamacare, because we should. We can learn that decisions have to be made by the patients and not by the bureaucrats or the government. There's some key examples of when the government starts making those decisions. I don't have to pick on Obamacare for it necessarily. The VA has had a few problems, and I'm sure all of you have been working casework on what the VA has been doing, and that's where the government and the bureaucrats are making decisions. And we've been through some enormous times on that. That's why we did the Choice Act, and the Choice Act had a lot of problems. That's government health care. And we say, well, no, choice isn't. That choice got to go outside of the government. Not quite true. I think the folks with the VA picked the companies that you had to go through for the health care. And when they did, they didn't want it to be efficient. They wanted as much of it to come back to the VA as possible. And so I'm sure that all of us, as we travel across our state, are running into people who are having problems with providers not getting paid or not being able to get their appointments. And if you check with the providers, you find out what kind of a terrible process they have to go through to get paid. That's government health care. And in my state, I provide the VA with a list every week of the new cases I've got of people that are not getting care. That shouldn't happen. But they told me when I first inquired, they said, well, there's only 2 doctors that haven't been paid. I said, that's impossible. There are more than 2 doctors in my own town that aren't paid. And there are a lot of towns in Wyoming, and as I go to them, I hear that they're not paid. So they said one was not paid for 30 days and one wasn't paid for 45 days. I said, well, I don't know why either of them weren't paid before those kind of deadlines, but I can tell you that there are a lot more problems than that. So if we're thinking about going to a federal health care, and I guess we're not because we had that vote a little bit earlier on whether we'd have a single-payer system, I was amazed at the number of people that chose not to vote on that. But at any rate, I don't think that's where America wants to go. I have had some people that have asked me about that. I've given them some suggestions on where to check to see what kind of care they would get under that, and they've come back to me and said, I don't think that's where we want to go. Now, I know that the other side of the aisle's wanted to go that way for a long time. Because when I first got here, Phil Gramm was one of my mentors, and I really appreciated all of his advice in so many areas. And one of the things that he said to me is, you got to watch out for health care. Because where the Democrats want to go is to single-payer health care. In other words, they don't care who drives the train as long as it wrecks. And so I look back on Obamacare and I say, man, this was 18, 19, 20 years ago that he was telling me this. And is that where Obamacare is supposed to go, to wreck the train so that we can go to single payer? I don't think so, but I think we're on the way to a train wreck. And I'm not hearing a lot of disagreement about the train wreck. I'm hearing some disagreement about the amount of calamity in the train wreck, but not on whether there's going to be a train wreck or not. There are a number of things that we could do to take care of the costs that have gone up under this, that can be confronted within a free market. That's as opposed to a government-run, government-controlled market that we're under now. One of them is to reduce the tax burden. I did notice that I had a lot of people in Wyoming. Again, we're one of the smallest, or the least populated state in the nation. We're big in land mass, but we're small in population. That $5 6/10 million were collected from Wyoming people for fines for not having the adequate health care. Those were people who said, wait a minute, I have to spend so much on my health care and then a high deductible that I'm never going to get anything out of it. So when I calculate the annual cost, the $1,700 that I have to pay as a fine, or $1,500, it's somewhere in that range, is cheaper than paying for all those premiums and then a deductible if anything ever happens to me. These are real people that I'm talking about.
Mr. President, would the Speaker yield to a question?
The Senate will be in order. The senator from Wyoming has the floor.
Would the Speaker yield to a question?
Another thing we can do, I allowed the other side to have their hour. I expect to have this hour, even if some of it is in silence. But they would reduce, I mentioned reducing the tax burden. Could also eliminate some regulations. Really need to take a look at some of those regulations that are within the essential health benefits and see if everybody needs all of them, or if there are some that they would opt out of given the opportunity because they know they will never need it. And there are a lot of examples of that. We could eliminate the mandates from the federal and state. We have the elimination of the federal mandates in this bill, both the individual mandate and the employer mandate. We could also increase the competition within the marketplace by increasing flexibility. Some of these things we can't do, particularly to the level that we'd like to do it. But we could have more competition if we could increase the number of insurance companies. Competition makes a difference. I've had a number of people, though, that have suggested to me that the biggest thing that we could do would be to pass some medical liability reform, because people are doctors are doing defensive medicine, which drives up the cost, and that's so that if they're ever in a lawsuit, they can prove that they did every possible thing that they could ever imagine or that anybody could raise as an issue, and there's a cost to doing that. And
Mr. President, I would ask the Speaker if he would yield for a question about the bill on the floor. The Senate will be in order. The senator from Wyoming has the floor. Would the senator from Wyoming
that the government
yield for a question?
An appropriate role in it.
Does the senator from Wyoming yield for a question?
I will not.
The senator declines to yield.
was here. So it's been suggested that the government could have an appropriate role in health care by maybe using advanceable refundable credits to prevent any lapse in coverage. One of the problems we've got right now is that people can wait until they have something terrible happen to them. And they can sign up for insurance on the way to the hospital. And you can't pay when you're in the ambulance, and you can't pay when you're getting the treatment, and you can't pay when you're getting rehab. And when they're done, they drop out of it. Now, it's pretty hard for an insurance company to figure in the cost of something they're not going to get paid for at all. There have been a number of suggestions. I don't know whether they're any good. I'd throw them out. One of them, and that was if you don't keep continuous coverage, you should have to pick up your own expenses for the first 6 months. That would encourage people to have continuous coverage. Just one possible suggestion.
Mr.
There is
President,
a role for government within this setting, and that's requiring some transparency within the system, encouraging the development of new healthcare competition and prevention of collusion between healthcare companies, and having prices posted. I remember a hearing that we had once.
Mr. President, will the Speaker yield for a question about the very interesting points that he's making?
I will not.
To ask for information about
the Senate will be in order. The senator declines to yield. The senator from Wyoming has the floor.
When either I was the chairman or when Senator Kennedy was the chairman of the Health, Education, Labor, and Pensions Committee, we switched from doing hearings to doing roundtables. And that's an interesting experience, too. Instead of having all of the witnesses except one picked by the majority and the other one picked by the minority, and then everybody coming up to beat up on the person that's in the opposite field, we went to roundtables. And what you do at the roundtable is you pick 2 or 6 or 8 or 10 people that are actually knowledgeable in that field, that have actually done something, that have had their hands on in what we were talking about. And I remember the first one, and one of the questions at the end of that was by Senator Kennedy, and he asked the witnesses that he and I had selected. This wasn't me selecting. This was a joint effort of selecting them. And he said, "What do you think about single-payer insurance?" And as they went around, there was only 1 out of 10 people that said, "Well, it might be a good idea, but we probably ought to take a look at it." The rest of them said, "It won't work in America. We're used to something different already." When that hearing was over, Senator Kennedy said to me, "I think these roundtables are a good idea. I think it's a good thing to kind of hear about what the people are actually experiencing out there before we write the bill." Well, we did a lot of health care roundtables. One of them, one of the witnesses was from Safeway. And Safeway had been able to hold their costs level and started to bring them down. And of course, we were interested in anybody that could hold health care costs level or bring them down. And the way that they had done that was to find out what the costs of different procedures were in the area where they had stores. And after they knew what the cost of the procedure was, they could take the median price for whatever it was, and if the people in their store would take the median price, it didn't cost them anything. If they went above the median price, they had to pay the difference. If they went below the median price, they got the difference. So they were actually paying attention, using some financial literacy in any of the treatments that they needed to get, and appreciated that their company had done this research for them in advance so that they could have some kind of an idea of what the market held. But he estimated that if we were able to increase the flexibility that they had with this, that they could bring down their costs by about 5 to 7% a year. I worked on a 10-step plan, worked in conjunction with Senator Kennedy on a lot of it, and talked about it across the country, and particularly across Wyoming. And it would have been 10 steps to get health care for everyone without mandates,
Mr. President,
but with incentives.
Mr. President,
And,
Senate will be in order.
Mr. President, the gentleman's talking about bringing down the costs. I wondered if he would yield for a question
Senate will be in order.
about the CBO report that calls for a 20% increase.
The senator declines to yield.
Would the gentleman yield for a question about the CBO estimate showing a 20% increase in premiums?
The senator will not yield.
The senator declines to yield. The senator from Wyoming has the floor.
Where my next marker is here. Earlier I mentioned the co-ops. I would have preferred the small business health plans. I didn't think the co-ops would work. The co-ops were included in the ACA. These plans were meant to provide competition with existing health insurance companies. It was an opportunity to set up insurance companies and actually was funded. The co-ops were given $2.4 billion in federal loans. The co-ops were prohibited from having former healthcare executives with managerial or accrual experience. The co-ops were conceived to drive down the premiums by providing competition and underselling the cost of policies. Now, more than half the 23 co-ops went out of business in 2015. But of the 8 of the remaining 11 co-ops were in financial trouble, and the number of co-ops is now down to 7. 4 of the prior co-ops went bankrupt in 2016. Examples of how the co-ops that have failed and have cost the taxpayer: in 2015 alone, there was a huge amount of money lost and also cost the enrollees in the co-ops their insurance. The New York Health Republic, 23,000 policies lost, $57 million lost in the first half of 2015. In Iowa and Nebraska, Co-Opportunity Health, 120,000 policies were canceled. $146 million were lost. In the Arizona co-op, 59,000 enrollees lost their insurance. $90 million lost. The Colorado co-op, 89,000 enrollees, insurance canceled.
Mr. President?
$72 million lost.
The Senate will be in order. The senator from Wyoming has the floor.
Mr. President, I wonder if the senator from Wyoming would
Does the senator from Wyoming
yield for a question about people losing coverage from Medicaid under this bill?
Yield. The senator from Wyoming has the floor.
The Health and Human Services Administration officials knew that the co-ops were at risk even before they received their first loan in 2014. Senator Rob Portman, chairman of the Senate Permanent Subcommittee on Investigations, said that the HHS knew of serious problems concerning the failed co-ops, their enrollment strategies, their pricing, and the financial management before the department ever approved their initial loans. Dr. Mandy Cohen, the director of CMS, testified before a House subcommittee that 8 of the 11 remaining co-op companies were in serious financial difficulty and receiving enhanced oversight and corrective action. Dr. Cohen did not explain what the corrective action or the enhanced oversight consisted of, nor could she indicate the enrollment figures and the possibility of financial service for the co-ops that were being monitored. Also, 4 more co-ops have failed over the first half of 2016, leaving only 7 remaining. I'm not sure what today's number is. The HHS continued to make these federal loans, though they knew the co-ops were failing. Under the small business health plans, there is no requirement to have the federal government fund it unless we want to fund more oversight, and I'm not opposed to that either. So what do the American people think of this? There's been greater than $1 billion lost to the taxpayers' money to co-ops that have gone bankrupt. Only 7 of the initial 23 co-ops remain in business. The co-ops were constructed as a way of providing competition against existing companies. However, in order to do that, they underpriced their products. No company can survive if they take in less than what they put in services, and understandably, the majority of the co-ops have gone out of business. That could be something to do with them being prohibited from having former healthcare executives with managerial and accrual experience. This was known by the HHH before the first federal loans had ever been approved. Over 800,000 people lost their insurance because the co-ops have gone out of business, and there are more to come. It speaks to the fact that HHS and Obamacare administration had very little regard for the American taxpayer and the American people. The disturbing question is whether any of the taxpayers' money will be returned. I did say that those were loans, and there aren't many left that can pay back the loans, which is a little bit of difficulty. Of course, we did hear that Obamacare was supposed to bend the cost curve down. So I ought to point out some facts on that as well. From 2009 to 2012, healthcare spending grew less than 4% as spending started increasing dramatically in the first quarter of 2014. This was the start of the implementation of the legislation. Subsequent healthcare spending from 2015 showed a 6 8/10% rise. In 2016, it is estimated to increase to 6.5% spending growth. Now, we know from last year, which isn't included in this, that it started doubling at that point. Deductibles both inside and outside Obamacare exchanges have increased enormously and will continue to increase. Healthcare costs are now increasing more than inflation. Why has spending increased? There has been increased utilization of services. The increased healthcare spending thus led to higher insurance costs. A particular cause of increased spending related to Obamacare is a marked increase in deductibles and health insurance premiums in the Obamacare exchanges. Additionally, because of the increased number of patients with Medicaid expansion, there have been increased costs, and healthcare costs will continue to rise. The total healthcare spending for 2016 is to increase over $3 trillion. I'll get some updated numbers on that. Total healthcare spending, the rate of spending increase, Medicaid increased at 11%, Medicare at 5.5%, private insurance spending increased 4 4/10%. If I would have known that Medicare was going to be mentioned, even though it's not in the bill, that I would have shown that a little chart that I have that shows how much revenue we get for different mandatory spending that we have. And all of those mandatory spendings are in a little bit of trouble because the revenue streams to take care of them are not sufficient. Now, at one point, they were sufficient in some of them, and the federal government doesn't have any place to park cash. The federal government puts bonds in a drawer and spends the cash. That's kind of double dipping because there's nothing there for later. There's a Social Security trust fund. I've learned from trust funds that you have to find money to put in before you can take money out. Never saw a trust fund that operated that way until I got here. So we have some crises that are coming up. You know, we're going to compound health care because with pensions, because for federal pensions, we really don't put any money away for them. We require businesses to put it away, and we've had some other suggestions. I have some small business pension plans that I'd like people to take a look at, some pooling for that I think would encourage more people to have pension plans in small business. But the cost of administration is extremely high unless they can share in that. But all of them would require that there be money put away to be able to cover with reasonable growth in the interest of the fund so that what was promised could be taken care of. And in 2006, Senator Kennedy and I worked on saving some pension plans, trying to make sure that promises that were made could be met. And we did a pension bill. It needs to be redone again, particularly for some sectors of the pension. But the private sector is required to put away money. Now, when the market goes down, it increases dramatically the amount of money that they need to put in and creates some problems for business. But the point I'm making is that the federal government doesn't do that. With any excess funds that we get, I don't care whether it's in health care or Social Security or where it is, those excess funds are allowed to be spent with bonds put in a drawer with the promise that the full faith and credit of the federal government will cover them. I don't know how many people at home believe that, but that's what it is. So how has the battle for the quality of health care, how has it fared? Well, this gets covered in this book too. You want to speak? Yeah. So a little bit on the quality of health care and outcomes. The infant mortality rate has been used by politicians and others in political debate to describe the inferiority of the U.S. healthcare system. The U.S. ranked only 30th in the world, and the neonatal mortality was below that. When you look at this data, however, you find a very different picture. The United States followed the World Health Organization definition that a live birth is any infant that shows any sign of life, a baby that takes a single breath or has a heartbeat. Other countries, however, including both developed and underdeveloped countries, use different standards. Their definition of live births varies between different countries. For example, in Switzerland, a newborn has to be 30 centimeters long to be considered a live birth. In Belgium and France, infants have to be at least 26 weeks old to be considered as live births. Infants less than 24 weeks gestational age are excluded from registries of live birth in multiple other countries, including Japan and Hong Kong. In Canada, Germany, and Austria, the newborns weighing less than 500 grams are not considered viable and are excluded from the infant mortality rates. So I guess what I'm saying is there are games that can be done with that, with the performance ratings, with the life expectancy data, with the Commonwealth Fund. All of these things are things that we're embarrassed about and things we ought to be working on, things we ought to improve, things we ought to help with our country. So we need to be looking at all those outcomes, the cancer outcomes, the cardiac disease outcomes, the stroke outcomes, the chronic illness outcomes, the hypertension outcomes, the diabetes and cholesterol outcomes. We know that the earlier and more effective there's treatment of the disease and the better treatment of the disease for chronic disease, the better off the results are. The more accessible and better technology that there is, the more access to specialty care for earlier diagnosis and treatment, and better preventive screening, and the inventiveness of the American people. See, I think it was today, my days kind of blend together these days with this health care that we're working on. I was visited by a couple of young people from Wyoming that have diabetes. And we have put some additional money into research. We as the Senate don't say exactly where that money has to go because we shouldn't be kicking the tires on the different diseases and figuring that out. I worry about where we might put the money if that were the case, because we're affected differently than what maybe our constituents are. But both of these young people were on a pump, and I've gotten to meet Dean Kamen, who invented the pump. And it's kind of an interesting story. Of course, that wasn't his first medical invention. His first medical invention was actually when he was a junior in high school, and his brother was having a residency in a clinic, in a hospital that handled transplants for infants. And they were mentioning some device that's similar to a needle, but medicine can evidently go through it, that was needed for a transplant of a kidney. And he was lamenting that they didn't have that capability. So Dean Kamen went down in the basement and figured out how to make one of those. And that was his first patent. And you probably know him more for the patents of the Segway. After he'd made some money, he got to experiment with some different things, and one of them is that mobile thing that police use and shopping centers use and tourists use, where you ride around on a Segway. But he built that for a specific medical purpose, which was to figure out a way to have a wheelchair that could climb stairs. That's, instead of building a ramp and being limited where there wasn't a ramp, he figured out a wheelchair that could climb stairs. It could do a number of other things too. For instance, if the person in a wheelchair went to a cocktail party, they could rotate the wheels up so that they were at standing level to everybody else. Had a lot of problems getting it through FDA. Finally got it through FDA, and then was told that there are other wheelchairs that are less expensive, so we're not going to pay for that. I think another company is coming back in to do that, but it's an outstanding experience to sit in a wheelchair and go downstairs with it. But he worked on this diabetic pump, and it's kind of interesting how he got into the diabetic pump. He realized that, or was told that, pregnant women who are on insulin, if they take the insulin doses, wind up often with babies that have a bigger head, which makes the delivery a bit more difficult. Now, everything changes so that the head becomes normal after a period of time, but it's a problem at childbirth. And he thought, what if we gave them the dose of insulin over a longer period of time? Would that have an effect on the infant? And so he invented a machine which started out as being a fairly good-sized machine, but it worked. It worked. If they got their insulin over a slow period of time, but sufficient insulin, the baby didn't have the larger head. Well, this man's a businessman. He said, that's good, and that will provide part of a market, but there ought to be a bigger market for it. He said, I wonder if men would have any benefit from having a diabetic pump. And so he was able to have a trial and find out that that also worked. And today he's invented it down smaller and smaller, and he's working on other kinds of inventions that will do even better things. But we need to keep putting things into the innovation. I've said a lot of times that if there's a problem in America and we put out a small incentive, there will be somebody that will figure out how to turn that into something very useful. I see that my how many minutes is and who Mr. President, I think I've been requested for Senator Schumer to have 2 minutes and to have 5 more minutes by UC perhaps for others. But I would ask that at the end that Senator Cornyn be allowed 2 minutes before the vote.
Mr. President,
the Democratic leader.
I'd ask unanimous consent that Mr. Cornyn can conclude, but I be given 5 minutes and then the senator from Oregon be given 5 minutes.
I was wrong. I need to have 5 minutes for Senator Cornyn.
And then 5 for Senator Cornyn after us.
Is there objection to 5 minutes for both sides?
No, five for Senator from New York,
Mr. President.
5 from the senator from Oregon, and 5 finally for the senator for however much time the senator from Texas wants.
Mr. President,
The majority whip.
reserving the right to object, I think it's only fair that each side get 5 minutes to speak. Everybody's ready to vote, and we've had 2 hours of debate. And so I would ask to amend the unanimous consent request that each side be given 5 minutes to close, and divide it up any way you want. And so I would ask consent that each side be given 5 minutes to speak.
I would simply say to my friend, this is a huge bill. We have not had a huge amount of time to debate it. We've just seen it for 2 hours. To ask for another 5 minutes on our side for the ranking member of finance in addition to mine is not too much to ask.
Mr. President, I object.
I suggest the absence of a quorum.
The Democratic leader.
I suggest the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.
President, I suggest I ask that the quorum be dispensed with.
Is there objection? Without objection.
I ask unanimous consent that there be given 5 minutes to the senator from Oregon, 5 minutes to myself, and in conclusion, 5 minutes to the senator from Texas.
Is there objection? So ordered. Democratic leader, or senator from Oregon.
Thank you, Mr. President. Thank my leader, Senator Schumer. Colleagues, before morning, millions of Americans could be on their way to lives filled with health care misery, eye-popping cost increases, hollowed-out coverage, gutted consumer protections. Colleagues, there are already stories of Americans hoarding pills and clamoring for screenings because they fear what the future is going to bring. These are the Americans who took deep breaths of relief 7 years ago when the Affordable Care Act became law. Women were no longer penalized for their gender. Cancer survivors no longer had to worry about busting a limit on coverage and facing personal bankruptcy. Entrepreneurs with a big idea had the freedom to set out on their own, no longer tied to their employer insurance because they had a pre-existing condition. Now, all of them are looking at lives on hold. This skinny repeal package makes a mockery out of the president's promise to lower premiums. He made that promise repeatedly to the American people. No reductions in coverage, no increases in premiums. This bill makes a mockery out of that presidential pledge. Don't take my word for it. The Congressional Budget Office, the independent umpires, have told us the premiums are going to jump 20% next year as a result of this bill. That goes into effect, colleagues, January 1st of this year. Some happy new year. Your premiums have jumped through the roof. Colleagues, vote for this and try to explain it to the people you represent and have them tell you that there's not going to be anything they can sacrifice to pay for that rate hike. Their wages are flat, and they're on an economic tightrope, and they're going to have premium hikes with a 20% hit. The Finance Committee is accountable for funds that are critical for women's health. This measure begins the effort to take away the right of women to go to the provider they choose. That, too, will be hard to explain to millions of Americans who simply want what we have, the right to make your own health care choices. Colleagues, the damage may get worse. Skinny repeal could be the gateway drug to full Trump care. We still don't know what's going to happen with Medicaid, so seniors are worried, kids with special needs, disabled folks. If the Senate and the House head to a conference, that's a big if. This body is going to face a radical set of demands from a very, very stubborn extreme on the other side of the Capitol. My time has expired. I appreciate Leader Schumer getting me this time. The promises that senators have gotten to protect their constituents, those promises could well be in the trash can within 48 hours. I urge my colleagues to think about what it's going to be like to go home and explain to their constituents how this health care misery came to be a part of their lives every single day. I don't think they're going to be able to make the case. I urge my colleagues to support Senator Murray on this motion to recommit, and I yield back.
Mr. President.
The Democratic leader.
First, let me thank my colleagues on the other side of the aisle for yielding us time. Well, Mr. President, this august body has been around for over 220 years. It has rules, it has traditions that we're very proud of. In recent years, both parties to blame, many of those traditions have been eroded. And what happens when you erode the traditions, the bipartisanship, the ability to work through the regular order, is very simply that the product that emerges is not very good. There's a reason that this body has been the greatest deliberative body in the world. And it's because it had those traditions. And now we don't have them. We've had a bill that we have seen for 2 hours. 2 hours. It affects the health care, perhaps the lives, almost certainly the lives of millions. It affects the lives, the daily lives of men and women and children. And we haven't even had a chance to explore all the ramifications. There's a lot of anger on the other side at the ACA. I understand that. But you're repeating what you claim are the same mistakes. And just as maybe Obamacare could have been made better if it were a bipartisan proposal, this one certainly would have been made better. Certainly would have been made better. This skinny repeal, CBO tells us, will kick 15 million people, 16 million people off care. This skinny bill, after all the cries of reducing premiums as the major reason that Obamacare needed changes, will raise premiums 20% a year ad infinitum. The average working family is going to struggle to get health care, even more than they have now. And why is this being rushed through this way? Why is this being done in the dark of night? I can't believe my colleagues are proud of it. If they were, there'd be brass bands down the streets of small-town America celebrating this bill. That's not what's happening. It's midnight. Debate is curtailed. We can't amend it in broad open. We can't do what's needed. So I would plead once more with my colleagues. Let's start over. We are the first to admit that the present law needs some changes. We are the first to want, maybe having learned our own lessons, that it should be done in a bipartisan and sharing way. Let's start over. We can do better. We can do better for all those people who are going to be hurt. We can do better for the institutions, the traditions of this great institution. We can do better as Americans who love our country and love our democracy and love our process. It is not too late to turn back from this proposal, ideologically driven, and do better, because we all are not proud of this product. I don't think there's hardly a one in this body who is proud of this product. Let's make this a turning point, not just on health care, but in how we function together. We plead with you. Let us recommit this bill. Let us vote against skinny repeal. And let's work together to improve our health care system in the way our founding fathers intended us to improve it. I yield the floor.
The Majority Whip.
Mr. President, it's important to remember how we got here. I still remember voting on the Affordable Care Act at 7:30 in the morning on Christmas Eve, because this bill, a 2,700-page bill that our Democratic friends did not read, and which Ms. Pelosi said we have to pass it before we know what's in it, that bill was passed on a party line vote and signed into law by President Obama without any participation of Republicans. So it's a little hard on the ears to hear my friend, the Democratic leader, plead for bipartisan solutions now. But I agree with him, it's not too late, because this is an open amendment process. Our Democratic friends, rather than trying to kill the bill, can help us make this bill better. And I suspect that, based on their comments, that they really need, we need to have some sort of remedial legislation 101, because this is not the end of the process. But in order for the House and the Senate to work together to come up with a bill that we both agree to, there is a conference committee on which both parties can appoint members of the conference committee to work out differences. But I don't believe that my friend, the Democratic leader, is really interested in working on a bipartisan basis to fix the structural defects in Obamacare. We know that the individual market is in meltdown. Premiums are skyrocketing, contrary to the promises made by the president when the bill was sold. We know that deductibles are so high that people are basically denied the benefit of their coverage. And yes, insurance companies are fleeing because they're bleeding red ink and they can't economically sell insurance on the exchanges anymore. So we all know something needs to be done, but we're not interested in just throwing more money at insurance companies, bailing out insurance companies, which is what I've heard from our friends on the other side. Well, it's not true. It's not the only thing we've heard. We've also heard the senator from Vermont, for example, advocate for a single-payer system. But what this bill does do is it repeals the individual mandate, which to us is an unacceptable government coercion of American citizens, forcing them to buy a product they don't want and they can't afford. Because currently 28 million people are uninsured under Obamacare. I thought it was supposed to provide coverage for everybody. But in my state, about 450 1,000 Texans who earn less than $25,000 a year are paying the penalty because they can't afford the insurance, so they pay the penalty, and it's not working. So we're doing everything we can, given the fact that our friends on the other side of the aisle are simply sitting on their hands and not participating in the process, other than to try to undermine it. We intend to pass a bill and go to conference with the House to make this bill better, because our goal is to stabilize the markets, to bring down premiums, to protect people with pre-existing conditions, and to put Medicaid, the safety net for low-income Americans, on a sustainable path. You would think those would be things that our colleagues across the aisle would want to join us in and participate in, but apparently not. So, Mr. President, we need to move on. We can't let the fact that our Democratic friends are unwilling to participate keep us from doing our duty the best we can under the circumstances, and that's what this bill represents. It is not perfect, but it's better than the status quo, and we intend to do our duty. Mr. President, I yield back.
All time has expired. The question is on the motion offered by the senator from Washington, Mrs. Murray. Is there a sufficient second? There appears to be. The clerk will call the roll.
Mr. Alexander, Ms. Baldwin, Mr. Barrasso, Mr. Bennett, Mr. Blumenthal, Mr. Blunt, Mr. Booker, Mr. Bozeman, Mr. Brown, Mr. Burr, Ms. Cantwell, Mrs. Capito, Mr. Cardin, Mr. Carper, Mr. Casey, Mr. Cassidy, Mr. Cochran, Ms. Collins, Mr. Coons, Mr. Corker, Mr. Cornyn, Ms. Cortez Masto, Mr. Cotton, Mr. Crapo, Mr. Cruz, Mr. Daines, Mr. Donnelly, Ms. Duckworth, Mr. Durbin, Mr. Inzie, Mrs. Ernst, Mrs. Feinstein, Mrs. Fisher, Mr. Flake, Mr. Franken, Mr. Gardner, Mrs. Gillibrand, Mr. Graham, Mr. Grassley, Ms. Harris, Ms. Hassan, Mr. Hatch, Mr. Heinrich, Ms. Heitkamp, Mr. Heller, Ms. Hirono, Mr. Hoven, Mr. Inhofe, Mr. Isaacson, Mr. Johnson, Mr. Kane, Mr. Kennedy, Mr. King, Ms. Klobuchar, Mr. Lankford, Mr. Leahy, Mr. Lee, Mr. Manchin, Mr. Markey, Mr. McCain, Mrs. McCaskill, Mr. McConnell, Mr. Menendez, Mr. Merkley, Mr. Moran, Ms. Murkowski, Mr. Murphy, Mrs. Murray, Mr. Nelson, Mr. Paul, Mr. Perdue, Mr. Peters, Mr. Portman, Mr. Reed, Mr. Risch, Mr. Roberts, Mr. Rounds, Mr. Rubio, Mr. Sanders, Mr. Sass, Mr. Schatz, Mr. Schumer, Mr. Scott, Mrs. Shaheen, Mr. Shelby, Mr. McCain, Mr. Shelby, Ms. Stabenow, Mr. Strange, Mr. Sullivan, Mr. Tester, Mr. Thune, Mr. Tillis, Mr. Toomey, Mr. Udall, Mr. Van Hollen, Mr. Franken, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young, Mr. Grassley, Senators voting in the affirmative: Baldwin, Bennett, Blumenthal, Brown, Cardin, Casey, Cortez Masto, Donnelly, Duckworth, Durbin, Feinstein, Franken, Hassan, Heinrich, Heitkamp, Hirono, Kane, King, Klobuchar, Manchin, Markey, McCaskill, Murray, Nelson, Reed, Sanders, Schatz, Schumer, Stabenow, Tester, Van Hollen, Warner, Warren, and Wyden. Ms. Collins. Mr. Johnson. Senators voting in the negative: Cochran, Collins, Cornyn, Daines, Enzi, Fisher, Graham, Grassley, Hoeven, Isaacson, Johnson, Kennedy, McCain, Paul, Perdue, Rounds, Sass, Shelby, Strange, Tillis, Wicker, and Young. Mrs. Ernst. No. Mrs. Shaheen? Aye. Mr. Roberts? No. Mr. Crapo? No. Mr. Udall? Aye. Mrs. Gillibrand? Aye. Ms. Cantwell? Aye. Mr. McConnell? No. Mr. Peters? Aye. Mr. Coons? Aye. Mr. Thune? No. Mr. Gardner? No. Mr. Blunt? No. Mrs. Capito? No. Ms. Harris? Aye. Aye. Ms. Murkowski? No. Mr. Alexander? No. Mr. Flake? No. Mr. Leahy? Aye. Mr. Sullivan? No. Mr. Carper? Aye. Mr. Menendez? Aye. Mr. Toomey? No. Mr. Corker? No. Mr. Inhofe? No. Mr. Cruz? No. Mr. Merkley? Aye. Mr. Scott? No. Mr. Hatch? No. Mr. Cassidy? No. Mr. Langford? No. Mr. Booker? Aye. Mr. Lee? No. Mr. Risch? No. Mr. Barrasso? No.
Just past your bedtime, kid? Past Jacksonville. Where are you from? Louisville. We got a good guy here from Louisville. Good. You talk. I've been here. Well, not well. Back and forth to the office. Folks been watching it all.
Mr. Rubio? Mr. Rubio? No. Mr. Heller? No. Mr. Burr? Mr. Burr? No. Mr. Cotton, no. Mr. Portman, no. Mr. Bozeman, no. Mr. Moran, no.
Are there any senators in the chamber wishing to vote or to change their vote? If not, the ayes are 48, the nays are 52. The motion to commit is not agreed to. The question is on the amendment number 667.
Request the ayes and nays.
Is there a efficient second? There is. Clerk will call the roll.
Mr. Alexander. Ms. Baldwin. Mr. Barrasso. Mr. Bennett. Mr. Blumenthal. Mr. Blunt. Mr. Booker. Mr. Bozeman. Mr. Brown. Mr. Burr. Ms. Cantwell. Mrs. Capito. Mr. Cardin. Mr. Carper. Mr. Casey. Mr. Cassidy. Mr. Cochran. Ms. Collins. Mr. Coons. Mr. Corker. Mr. Cornyn. Ms. Cortez Masto. Mr. Cotton. Mr. Crapo. Mr. Cruz. Mr. Daines. Mr. Donnelly. Ms. Duckworth. Mr. Durbin. Mr. Enzi. Mrs. Ernst. Mrs. Feinstein. Mrs. Fisher. Mr. Flake. Mr. Franken. Mr. Gardner. Mrs. Gillibrand. Mr. Graham. Mr. Grassley. Ms. Harris. Ms. Hassan. Mr. Hatch. Mr. Heinrich. Ms. Heitkamp. Mr. Heller. Ms. Hirono. Mr. Hoven. Mr. Inhofe. Mr. Isaacson. Mr. Johnson. Mr. Kane. Mr. Kennedy. Mr. King. Ms. Klobuchar. Mr. Langford. Mr. Leahy. Mr. Lee. Mr. Manchin. Mr. Markey. Mr. McCain. Mrs. McCaskill. Mr. McConnell. Mr. Menendez. Mr. Merkley. Mr. Moran. Ms. Murkowski. Mr. Murphy. Mrs. Murray, Mr. Nelson, Mr. Paul, Mr. Perdue,
No. Sorry, yes.
Thank you.
Mr. Peters, Mr. Portman, Mr. Reed, Mr. Risch, Mr. Roberts, Mr. Rounds, Mr. Rubio, Mr. Sanders, Mr. Sass, Mr. Schatz, Mr. Schumer, Mr. Scott, Mrs. Shaheen, Mr. Shelby, Ms. Stabenow, Mr. Strange, Mr. Sullivan, Mr. Tester, Mr. Thune, Mr. Tillis, Mr. Toomey, Mr. Udall, Mr. Van Hollen, Mr. Warner, Ms. Warren, Mr. Whitehouse, Mr. Wicker, Mr. Wyden, Mr. Young, Senators voting in the affirmative: Alexander, Barrasso, Blunt, Bozeman, Burr, Capito, Cassidy, Cochran, Corker, Cornyn, Crapo, Daines, Enzi, Ernst, Fisher, Flake, Gardner, Graham, Grassley, Hatch, Hoeven, Inhofe, Isaacson, Johnson, Kennedy, Lankford, Lee, McConnell, Paul, Perdue, Portman, Risch, Roberts, Rounds, Rubio, Scott, Shelby, Strange, Sullivan, Thune, Tillis, Toomey, Wicker, Young. Senators voting in the negative: Baldwin, Bennett, Blumenthal, Booker, Brown, Cantwell, Cardin, Carper, Casey, Collins, Coons, Cortez Masto, Donnelly, Duckworth, Durbin, Feinstein, Franken, Gillibrand, Harris, Hassan, Heinrich, Heitkamp, Hirono, Kane, King, Klobuchar, Leahy, Manchin, Markey, McCain, McCaskill, Menendez, Merkley, Murkowski, Murphy, Murray, Nelson, Peters, Reed, Sanders, Schatz, Schumer, Shaheen, Stabenow, Tester, Udall, Van Hollen, Warner, Warren, Whitehouse, Wyden. Mr. Moran. Mr. Moran, aye. Mr. Cotton. Mr. Cotton, aye. Mr. Cruz. Mr. Cruz, aye. Mr. Heller. Mr. Heller, aye. Mr. Sass. Mr. Sass, aye.
Oh my God, check the contact.
Are there any members in the chamber wishing to change their vote? If not, the ayes are 49, the nays are 51. The motion is not agreed to. The amendment is not agreed to.
Mr. President,
Majority Leader.
I ask unanimous consent that H.R. 1628 be returned to the calendar.
Is there objection? Without objection.
So, Mr. President, this is, clearly a disappointing moment. From skyrocketing costs to plummeting choices and collapsing markets, our constituents have suffered through an awful lot under Obamacare. We thought they deserved better. It's why I and many of my colleagues did as we promised and voted to repeal this failed law. We told our constituents we would vote that way, and when the moment came, most of us did. We kept our commitments. We worked hard, and everybody on this side can certainly attest to the fact that we worked really hard to try to develop a consensus for a better way forward. And I want to thank everybody in this conference for the endless amount of time that they spent trying to achieve a consensus to go forward. I also want to thank the President and the Vice President, who couldn't have been more involved and more helpful. So yes, this is a disappointment indeed. Our friends over in the House, we thank them as well. I regret that our efforts were simply not enough this time. Now imagine many of our colleagues on the other side are celebrating, probably pretty happy about all this. But the American people are hurting and they need relief. Our friends on the other side decided early on that they didn't want to engage with us and in a serious way, to help those suffering under Obamacare. They did everything they could to prevent the Senate from providing a better way forward, including such things as reading amendments for endless amounts of time, such things as holding up nominations for key positions in the administration because they were unhappy that we were trying to find a way to something better than Obamacare. So I expect that they are pretty satisfied tonight. I regret to say that they succeeded in that effort. So now I think it's appropriate to ask, what are their ideas? It'll be interesting to see what they suggest as the way forward. For myself, I can say, and I bet I'm pretty safe in saying for most of the people on this side of the aisle, that bailing out insurance companies with no thought of any kind of reform, it's not something I want to be part of. And I suspect there are not many folks over here that are interested in that. But it'll be interesting to see what they have in mind. Quadrupling down on the failures of Obamacare with a single-payer system. We had that vote a little earlier, thanks to the senator from Montana. Almost everybody voted present. Apparently they didn't want to make a decision about whether they were for or against socialized medicine, the government takeover of everything, European health care. Only 4 of them weren't afraid to say they didn't think that was a good idea. So maybe that's what they want to offer. We'll be happy to have that debate with the American people. So it's time for our friends on the other side to tell us what they have in mind. And we'll see how the American people feel about their ideas. So I regret that we're here, but I want to say again, I'm proud of the vote I cast tonight. It's consistent with what we told the American people we'd try to accomplish in 4 straight elections if they gave us a chance. And I want to thank all of my colleagues on this side of the aisle for everything they did to try to keep that commitment. What we tried to accomplish for the American people was the right thing for the country. And our only regret tonight, our only regret, is that we didn't achieve what we had hoped to accomplish. I think the American people are going to regret that we couldn't find a better way forward. And as I said, we look forward to our colleagues on the other side suggesting what they have in mind. So now, Mr. President, it's time to move on. And I ask unanimous consent that at 10 a.m. on Friday, July 28th, that's tomorrow, the Senate proceed to consideration of calendar number 175, H.R. 2810, the House-passed National Defense Authorization Bill.
Mr. President.
Objection?
I object.
The objection is heard.
I suggest the absence of quorum.
Mr. President. Mr. President.
Give us a second.
The clerk will call the roll.
Mr. Alexander.
Leader.
I ask unanimous consent the quorum be dispensed with.
Is there objection? Without objection.
Thank you, Mr. President. And first, let me say it's been a long, long road for both sides. Each side had sincere convictions, and we're at this point. So I want to say 3 things. First, I would suggest we turn the page. It's time to turn the page. I would say to my dear friend, the Majority Leader, we are not celebrating. We are relieved that millions and millions of people who would have been so drastically hurt by the 3 proposals put forward will at least retain their health care, be able to deal with pre-existing conditions, deal with nursing homes and opioids that Medicaid paid for. We are relieved. Not for ourselves, but for the American people. But as I said over and over again, Obamacare was hardly perfect. It did a lot of good things, but it needs improvement. And I hope one part of turning that page is that we go back to regular order, work in the committees together to improve Obamacare. We have good leaders, the senator from Tennessee and the senator from Washington, the senator from Utah, the senator from Oregon. They have worked well together in the past and can work well together in the future. There are suggestions that we are interested in that come from members on the other side of the aisle, the senator from Maine, the senator from Louisiana. So let's turn the page and work together to improve our health care system. And let's turn the page in another way. All of us were so inspired by the speech and the life of the senator from Arizona. And he asked us to go back to regular order, to bring back the Senate that some of us who were here, have been here a while, remember. Maybe this can be a moment where we start doing that. Both sides will have to give. The blame hardly falls on one side or the other. But if we can take this moment, a solemn moment, and start working this body the way it had always worked until the last decade or so, with both sides to blame for the deterioration, we will do a better job for our country, a better job for this body, a better job for ourselves. And finally, I'm glad that the leader asked us to move to NDAA. We need to do it. I can say on this side of the aisle, we will move expeditiously. I know that the senator from Rhode Island has worked with the senator from Arizona on a list of amendments that can be agreed to, and we can finish this bill up rather quickly. And as I mentioned to the majority leader, there are some other things we can do rather quickly, including moving a whole lot of nominations. So we can work together. Our country demands it. Every place in every corner of the world, of the country where we go, the number one thing we are asked, and I know this because I've talked to my colleagues on the other side of the aisle, is, can't you guys work together? Let's give it a shot. Let's give it a shot. I yield the floor.